In October 2017, the government introduced a policy which forces all NHS trusts to check immigration status and charge upfront those deemed ineligible for free care. This was an extension of the hostile environment for migrants we have in the UK.
As healthcare workers,
we think this is a racist,
discriminatory
and harmful policy, and we want it scrapped.
Solidarity knows no borders. This weekend we'll be taking action to get justice for those who've had their lives destroyed by these racist policies.
Although Sheffield is proud to call itself a city of sanctuary, it still charges people for access to healthcare, even when that healthcare is a matter of life and death. In 2019, Simba suffered a severe stroke.
He has a clotting problem but stopped attending his haematology appointments as he was being threatened with a bill to pay £7,000 up front. As he woke up in hospital, he was presented with a bill totalling £93,000.
However, the cost to himself and his family is far more than the monetary value of that treatment. Simba has lived in the UK most of his life, but has still not been granted asylum after 16 years.
As an asylum seeker in the UK, you have no right to work, and so Simba has no way even of working to pay off his debt. He, like many other people living in the UK in similar conditions, was unable to access hospital services because of the upfront costs, and so his health declined, and this arguably led to his stroke. Simba has still not fully recovered and completely relies on his fiancée and support from a crowdfunder. There are countless other stories similar to Simba's.
Healthcare staff have been fighting back against charging for migrants. The NHS was founded on the principle of healthcare is free at the point of use. Upfront charging of migrants directly contradicts this principle.
It is currently a legal requirement to check the immigration status of any patient in the UK who is suspected to be ineligible for care. Overall, this promotes racist and discriminatory practices within the NHS, targeting those patients from abroad.
The relationship between patients and NHS staff is vital to providing effective and safe healthcare. If a patient doesn't trust or doesn't feel comfortable around staff because they're being pestered to prove their eligibility, how are they going to feel safe in the hands of our team?
Why would they trust healthcare staff when it seems we care more about their immigration status than their health?
healthcare workers have been turned into border guards. We've all heard the stories of how Windrush generation patients were refused care or mistakenly charged, leading to deaths after the Windrush scandal. Across the country, people are dying after being refused life-saving healthcare. Can we morally accept this?
So over the past few years, campaigns like Patients Not Passports, Medact and Docs Not Cops have started the fight against the discriminatory nature of this hostile environment and its upfront charging. As healthcare workers, we believe it is utterly immoral to charge anyone for essential healthcare, especially those who are the most vulnerable in our society.
We are talking,
demonstrating,
campaigning,
fighting
for a change to this racist system.
We demonstrate across the country to show our support for migrants' rights to access healthcare.
And we campaign to end this hostile environment.
And get justice for those already affected by it.
We fight for change.
We fight for change.
We fight for change.